My name is Thomas Liedtke. I'm a physician. I work for Intercomponentware. I'm head of emerging healthcare, reporting directly to the board of directors. And my task is twofold. One side is I develop new business for the company in terms of emerging healthcare, emerging stuff which comes up in the healthcare system internationally. And on the other hand, I'm developing prototypes. We are sort of a rapid prototyping company which is able to develop prototypes within 6 months, to develop and to produce before our customers, before potential clients and before the board, to get them a hand in deciding whether this emerging healthcare topic, like ambient assisted living, like patient individualized repackaging of medication, like genomics, could be of any value for the company and could be a valuable opportunity internationally. Emerging healthcare is a very broad area, and for ICW it starts as where we can try to develop products which can be in place within the next year, within the next 5 years, within the next 10 years maybe. And one of the examples for the prototypes we're developing is ambient assisted living, which helps old people to retain their mobility, to enable them to live at home, assisted by technology which they won't be able to touch, but which they will be able to feel, which will be able to assist them in their daily business, which will be able to help physicians, to alert physicians if there are problems, medical problems. So ambient assisted living is emerging healthcare's main topic at the moment, which is closest to reality. One example we are developing is individual repackaging of medication, which means a patient, mostly elderly patients living at home, living in old people's home, for example, those patients have to take lots of medication, 15, 20 different drugs per day, to 5, 6, 7 times intake times they have to use. People and their spouses really get easily overwhelmed by that, get confused, take the wrong medication, don't take medication at all, take medication 2 or 3 times the dose. That leads, of course, to problems, emergency physician visits, hospital admissions and so on. So the solution here is just a very simple one. A patient gets a bag where this patient always finds all the drugs he or she needs to take for one time. So he gets a bag in the morning, at night, midday, and any time in between. So the only thing the patient or the spouse has to do, open the sachet, open the bag, and take the medications, which really helps, on one hand, saving costs, and on the other hand, helps to retain the patient's mobility and independence. There are very good studies around which took part in the Netherlands and Germany and the Northern European countries, which show that up to 30%, which is a lot, up to 30% of the patients take the wrong drugs to the wrong time, the wrong amount, which leads to unnecessary physician visits, hospital visits, and of course unnecessary deaths. So reducing that to about 0.1% is obvious that will help cut costs, because the extra cost for a blister pack, as we call it, is about €6 a week, which is nothing compared to the costs that occur when patients need to be hospitalized or so. So there's clear evidence, clear study evidence and clear practical evidence, and that's the reason why insurance companies are very much interested in blister packages. There's clear evidence that this could help save costs and prolong the life and the healthy life of patients. One of the outlying topics we take care of in emerging healthcare is genomics, as I mentioned before. Genomics will take to start off within the next 5 years, I guess, in Europe, in Germany. If you look at the United States, it's been taken over a little earlier. And in particular for Europe, people do have some problems accepting new technologies, accepting the privacy issues which come with genomics, affect data security, which will of course affect the amount of data which need to be processed. So we've got the technical side, and the other side is the cultural side. People really need a good case. They need to see, they need to learn that my relative has survived his cancer because there was a new test involved that was done by genomics. And as long as we haven't got those sort of popular success stories, people are very critical about privacy issues, about costs, and about the technology underlying genomics. And I think in the near future we will see very many, not only one, we will see very many cases where really people benefit from genomics tests, and after that those business will take off. If you talk to insurance companies, for example, even insurance companies today, nowadays, have their own work groups. They have their own genomics work groups. So insurance companies in Germany, they know exactly what's going on. They know exactly that this new technology will take off, and they're sort of positioning themselves how to best to tackle those problems coming with it. If you look at the costs for genomes, I mean, Craig Venter with the first one sequencing the whole genome, it was a couple of $100 million, I guess, they invested. Now you can have a genome sequenced for a little more than $100,000, and within the next 2 to 3 years, and the technology is really exploding at the moment, within the next 2 to 3 years we will see the costs for genome sequencing coming down to $1,000, maybe perhaps to $500, if you leave out some areas of the genome which are not very interesting at the moment. So we are talking about the $1,000 genome in the near future, and the future will be much closer than you read in the literature and you see before. If you look back the past 30 years or the past 15 years, the costs of healthcare have been rising. They have been rising for various reasons. They have been rising because the population is aging, everybody knows this. They have been rising because of increasing technology and so on. They have been rising because of increasing safety standards, increasing standardization. And I think it's an illusion. It's an illusion to expect a new technology like CT scan, like MR scan, a new technology like genome to cut the cost of healthcare. I mean, we have to face the problem that the healthcare costs will keep rising. But on the other hand, the benefit is people live longer, and people live longer, a fitter life up to the end. And I think we have to bear those costs, maybe on an individual basis, maybe as a society as a whole. I would have never expected 5 years ago that personal health records and the interlinking, the networks between hospitals and physicians would take off so soon and so steep as we are just seeing it at the moment. If you look at the discussions within physician groups, I mean, 5 years ago they were sort of waving the flags of ethics and waving everything the most for every patient and no cost cut and nothing. You're now sort of realizing that you can't get everything for nothing, which is one thing, and you realize, and that's the most important thing, you realize that technology, in particular information technology, could be a real good driver for those advances in medicine. The tipping point, I think, has been reached right now. The tipping point, at least from the German perspective, will be the introduction of the healthcare card for every citizen, which will trigger then the interlinking of every necessary bit of information, so that every physician, every hospital, and even every patient has access to medical information in time which is needed where it is needed. That is one point, and the other point is I see the evolution of sort of a personal medical assistant coming up. That is sort of a translation person, which is the man in the middle and translates the information, no matter whether it stems from genomics or from other high-tech sources, whether this person should be able to translate those medical information to a patient digestible form, to a physician digestible form, and of course to the insurance people as well. So that I see 2 points again to repeat this. One is we will see the interlinking, we will see networks, we will see server-based information systems, and we will see the evolution, the rise of people whose profession it will be to translate medical information to whomever it belongs to and whoever needs it.